Yeah. Hi, my name is Victoria.
Hi, I'm Lindsay.
I'm Allie.
I'm Nikki. We did our project on the evaluation of regular exercise in young adults to reduce cardiovascular risks. Our question was, in young adults aged 18 to 35, how does regular exercise compared to no exercise reduce cardiovascular risks through adulthood? And the databases we used were CINAHL, Cochrane, Medline, and PubMed. The keywords were exercise effects on cardiovascular health, adults ages 18 to 35, young adults ages 18 to 35, benefits of exercise, cardiovascular health, sedentary lifestyle effects on cardiovascular health, lack of exercise, cardiovascular health concerns, long-term effects of exercise, reduced cardiovascular complications, and the inclusion criteria was that participants must be between 18 through 35 years old. They must not have any pre-existing cardiovascular problems, and they must be able to fall into one of two groups, which is a regular exerciser or a non-exerciser. The search results was that 108 studies were identified, and after duplicates were removed and studies were assessed for eligibility per inclusion and exclusion criteria, 6 articles remained for analysis, and one of them was a systematic review, one was a prospective cohort study, there was one RTC, 2 meta-analyses, and one clinical guideline. And we picked this topic because heart disease is the leading cause of death in the United States. And in 2024, the US reported a total of 700,880 deaths from heart disease. And research shows that exercise reduces cardiovascular risk factors regardless of body weight or comorbidities such as diabetes. Recent studies have shown that regular physical activity is associated with decreased risk of heart failure, improvement in metabolic health, and an improvement in overall survival. Exercise increases the formation of blood vessels in the heart, which protects against vascular stress and reduces the chances of a cardiac event.
So our conceptual framework, we went with the Iowa model. So first we identify the problem. This is where we found the articles of scientific research that identified the rising concern for cardiovascular risks from inactive young adults. Then you form a team. The interprofessional care is important, especially in regards to following long-term effects of cardiovascular health benefits of regular exercise. Our findings show that physicians, nurses, dietitians, exercise specialists, etc., were all involved in the process of these studies. The assembling and evidence critique, all sources with systematic reviews and meta-analyses studying and following results of active young adults versus those who were inactive, and the long-term cardiovascular health outcomes between the two groups of individuals being followed. Pilot the change. So this is where the clinical guidelines suggest aerobic exercise being used for prevention of cardiovascular benefits. It's brought into the clinical settings such as wellness programs, primary care doctors, and community groups in order to focus on educating young adults on the benefits of exercise. And finally, the evaluation stage is assessing whether implementing these regular exercises in this age group leads to measurable decreases in cardiovascular incidence later on in life.
Yes, so the overall findings of our evidence review highlight the significant impact that regular cardiovascular exercise in young adulthood has on reducing long-term cardiovascular disease risks. The studies reviewed consistently demonstrate that individuals who engage in consistent physical activity experience more favorable heart health outcomes, including lower blood pressure, lower cholesterol, decreased arterial stiffness, and a reduced incidence of conditions such as hypertension, coronary artery disease, stroke, and type 2 diabetes. These outcomes support the conclusion that early lifestyle interventions are not only beneficial, but essential in the prevention of chronic cardiovascular conditions across the lifespan. A recurring theme across the literature is that the benefits of physical activity and the earlier healthy habits are adopted, and the more consistently they are maintained, the more profound the impact on long-term cardiovascular health. Several studies indicate that even modest increases in physical activity during young adulthood are associated with significantly decreased risk of premature cardiovascular events. Furthermore, engaging in both aerobic and resistance training appears to offer comprehensive benefits by improving multiple physiological markers related to cardiovascular risk. These findings carry important implications for clinical practice. Healthcare providers, particularly those in primary and preventative care, should prioritize early and ongoing education about the importance of physical activity. Routine health visits present valuable opportunities to counsel patients, set realistic activity goals, and connect individuals with tools such as mobile health apps, community exercise programs, or structured wellness plans. Providers should also consider incorporating screening questions related to physical activity into standard assessments and using electronic health record prompts to facilitate these conversations. Moreover, the studies point to the importance of addressing common barriers to exercise, such as time limitations, lack of motivation, financial constraints, or limited access to safe environments. Tailored interventions that account for patients' lifestyles, preferences, and social determinants of health are more likely to result in sustainable behavioral change. In summary, the collective evidence strongly supports that regular exercise beginning in young adulthood is vital, evidence-based strategy to significantly lower the risk of developing cardiovascular disease. By emphasizing early prevention, encouraging long-term adherence to physical activity, and addressing implementation barriers, healthcare providers can help shift the focus from reactive treatment to proactive wellness, ultimately improving quality of life and reducing the burden of cardiovascular disease on individuals and the healthcare system as a whole.
Our implications for practice. The first, the understood exercise should be integrated into routine health care like medication. So you'll need a type, frequency, duration, and intensity. Exercise should be tailored to the individual and consider their age, fitness level, their personal preferences, and comorbidities to create plans with achievable goals and ensure adherence and safety. You should promote early physical activity, encourage cardiovascular exercise starting in young adulthood to reduce the long-term effects of cardiovascular risks. Integrate exercise education into routine care, include discussions on the benefits of regular exercise during wellness visits and annual checkups. Use patient-friendly tools, recommended fitness apps, trackers, or online resources to help young adults being and maintain an exercise routine. Utilize reminders in EMRs, add prompts, and electronic health medical records to remind providers to address physical activity at each visit. Focus on prevention, shift practice culture toward preventative care by prioritizing lifestyle changes like exercise over medication when appropriate. You should also collaborate with interdisciplinary teams, work with dietitians, physical therapists, community health workers to create a holistic, sustainable health plan. For our conclusions, the finding from this evidence-based review strongly support that regular cardiovascular exercise initiated in young adulthood significantly reduces the risk of developing cardiovascular disease late in life. Across all 12 high-quality studies, there's a clear, consistent link between physical activity and improved heart health outcomes, including lower blood pressure, reduced arterial stiffness, decreased cholesterol levels, and overall reduced mortality from cardiovascular causes. The evidence emphasizes that early education and promotion of exercise by healthcare professionals can play a key role in preventing heart disease. By implementing routine counseling and making physical activity a regular part of health conversations, the health system can facilitate lasting behavioral change that promotes lifelong cardiovascular wellness. This concludes our presentation.
And those are our references. Okay.